everyone, I am Dhruva. Welcome back to my channel. In today's video, you will all know about how does COVID-19 affect your lungs and what is your chance risk of getting coronavirus. COVID-19 is a respiratory disease, one that especially reaches into your respiratory tract, which includes your lungs. COVID-19 causes a range of breathing problems from mild to critical in older adults with health conditions like heart disease, cancer, and diabetes can have much more serious symptoms. COVID-19 and your lungs. SARS-CoV-2, the virus that causes COVID-19, is a part of the coronavirus family. When the virus gets into your body, it comes into contact with the mucous membrane that lines your eyes, nose, and mouth. It uses a healthy cell to make its parts and then it multiplies and the new viruses infect its nearby cells. Think of your respiratory tract as an upside down tree. The trunk is the trachea or windpipe, which divides into smaller and smaller parts, like smaller and smaller branches, and at the end of each small branch are alveoli, the place where oxygen goes into your blood and carbon dioxide comes out. Coronavirus infects your upper or lower part of your respiratory tract. It travels through your airways. It irritates or inflames your linings, and in some cases, it can reach all the way down into your alveoli. COVID-19 is a new condition, and doctors are still learning about the effects made on your body by it, and they think it is similar to the other two coronavirus diseases, SARS and MERS, severe acute respiratory distress and severe acute respiratory syndrome, and Middle East respiratory syndrome. Mild and moderate cases. As the infection travels down your respiratory tract, your immune system fights back, and in this process, your lungs and airways swell and become inflamed. This can start at one part of your lung and then spread. About 80% of the people who get COVID-19 have mild to moderate symptoms like cough or sore throat, etc. Few might have pneumonia, which causes the inflammation of alveoli. Doctor can see respiratory inflammation on chest X-ray or CT scan. When doctor takes a chest CT, they can see something they call as ground glass opacity because it looks like frosted glass on a shower door. Severe cases. About 14% of the COVID-19 cases are severe with an infection that causes both the lungs, which infects both the lungs, and as the swelling gets worse, your lungs fill with fluid and debris. This can lead to severe pneumonia, or your air sacs fill with fluid, mucus, and other cells trying to fight the infection. This can make it really hard for your body to take in oxygen, and you might have trouble breathing, or you might feel short of breath, or you might breathe faster. Your doctors, when they take a CT scan, they can see that the opaque spots, they look like they start to connect to each other. Critical cases, about 5% of the total COVID-19 cases are critical. The infection damages the walls and the linings of the air sacs of your lungs, the air sacs of your lungs, and then when the body tries to fight it, your lungs swell and become inflamed, and then it fills with more fluid. This will make it really hard for your body to swap oxygen and carbon dioxide. In most critical cases, your lungs need help from a machine called ventilator to do their job. About 20 to 30% of the critically ill patients develop clots in the brain, heart, lungs, and legs. Some of them are life-threatening. Few patients needed lung transplant because of severe tissue damage from COVID-19. COVID-19 complications, you might need some time to recover from pneumonia. You might observe that you can't exercise like you used to, or you might feel more tired than usual. And also some people had cough after COVID-19 recovery, and also they had scarring in their lungs, and doctors are still learning whether these effects are permanent or might heal over time. Most of the people who got ill by the COVID-19 illness caused by the new coronavirus are adults. Babies essentially don't seem to have much risk, but infants seem to have higher risk, and experts are not sure about it. Higher risk means the risk of accidentally spreading it to others, not get sick from it. There are simple ways to prevent this: staying home, no in-person play dates, washing your hands regularly, cleaning your home regularly, and staying away from sick people, wearing a mask when around others. Parents would want to reassure whether your child is anxious about the changes made in their routines, like staying home from school and not seeing their friends face to face. Watch for unusual worry or sadness, or trouble waking up or eating, or attention problems. Talk to your children about what is happening and reassure them that most cases are mild and your children might pick up cues from this, so it is important that you stay calm too. Are the symptoms of COVID-19 same in children and adults? When children and teens get sick from COVID-19, their symptoms seem to be much milder than in adults. The number of hospitalizations are really less in among the people of US below the age of 19. And according to the researchers, over 90% of the people, the children who get sick from COVID-19 have mild to moderate cold-like symptoms, which are as follows, like fever, cough, runny nose, vomiting and diarrhea. Some patients have been hospitalized with a condition called multisystem inflammatory syndrome in children or pediatric multisystem inflammatory syndrome. Uh, Doctors think this is a condition related to the new coronavirus, and the symptoms of it are fever, belly pain, vomiting, diarrhea, headache, confusion, and rash. These are similar to those of the Kawasaki disease or toxic shock syndrome, which causes the blood vessel inflammation in children. How to protect my child from COVID-19? There are vaccines which are available for immediate use, for emergency use, for those in 18 years and above, but it is important that you should be able to do anything that is possible to protect your child and your family. So there are simple ways to cut the risk of illness, like staying home, no in-person play dates, always stay masked up, wash your hands regularly, clean your home regularly, and take care when you get sick. I hope you liked this video, so give it a like, share it with your friends and family, and subscribe to my channel before you go. Thank you. Stay home, stay safe.